All right. So, what do you do? You're a doctor, and what do you do if you have a patient who is suicidal? And let's just talk about a general patient, and that. And the first thing I would have you do is I would have you respond to their current needs. And the needs of the brain are very clear. The brain, in order for it to function, has to have three major things. The cells in the brain, the neurons, have three things that they absolutely have to have. Number one is oxygen. And this sounds remedial. Well, it's a little more dicey when you start to really dig into it, right? Got to have oxygen, number one. Number two, carbs and sugars, because brain and red blood cells can only operate on carbs and sugars. And then three is activation. And if you don't use it, you lose it. And that's the essence of plasticity, is when you stress it, when you stress the nerve, it has to go through what's called immediate early gene response, which is what I call cellular housekeeping. Stuff goes bad, it has to be replaced. But it only is replaced when you fire it, when it's active. And that causes changes. It causes you to replace things, causes you to replace microtubules and mitochondria that are going bad, because all of it goes bad because it's getting used. And so we have to replace it. And so that whole process has to happen. Here's the thing. In order to fire the nerve and do immediate early gene response to fire it, you have to have protein. And so that protein, why? Because the protein is what everything is made of. So if you don't have protein, you can't fire the nerve. And you wind up, if you don't use it, you lose it. When we look at plasticity on the number line, right, the positive number line, positive X, there's a dark side, which is the negative, and we call that transneural degeneration. If I keep not firing it, it gets weaker and weaker. Stuff starts breaking down, microtubules, microfilaments, all the vacuoles and all the things that are going to elicit all of the functions in the little city that we call the neuron. All those things have to be replaced. Well, they're not getting replaced, so they're breaking down. They become cellular junk, and the cell becomes more and more dysfunctional. And we would think that it wouldn't be able to fire. Actually, it's able to fire more and better, faster. It can take stuff like, let's say it's got a neurotransmitter that it likes to respond to cause it to fire. It can respond to anything, right? The cells respond to a certain neurotransmitter to make it fire. In neurobiology, we see all neurotransmitters as excitatory, but they don't all cause it to fire. They'll call it one is inhibitory, that like a GABA, the GABA-aminobutyric acid will cause the cell not to fire, right? It'll cause immediate early gene response, but it will cause it not to fire and reset, which all takes energy, right? And so most of the brain and the neurotransmitters within the brain are actually inhibitory rather than what we call excitatory. But you've got to have those needs filled. If you're trying to chemistry somebody, if I'm trying to functional neurology somebody, and they don't have the right amount of oxygen, or they don't have the right amount of carbs and sugars, and they don't have enough protein to facilitate the ability to fire those nerves, they are at severe fatigue, and anything they've got is going to get worse. You're going to make them worse by doing whatever it is you're doing. And so you got to see, I got to make sure they're getting the right amount of oxygen. So what are the problems with oxygen? Well, we can start of trying to get it in. What if they have asthma? What if they have COPD? What if they have severe postural issues that make it difficult? If you lose the forward head posture, if you wind up with a forward head posture instead of having your head over the center of your body, according to Renee Callier of USC Med School, you use you lose 30% of your vital capacity. If your sacrum is locked up and it can't do its pumping activity, which, by the way, causes cerebral spinal fluid to flow because the filum terminale ligament beats the flow of CSF, which bathes your brain and spinal cord, it also facilitates the leverage factor that makes breathing more easy from the bottom up. And if, let's say, you have ribs that are locked up, it makes expansion. So that's just getting it in. Then let's say we're getting it in and we have any of a number of lung issues, but then once we get it into the blood, did we get it into the blood? Do we have anemia? So if we have anemia, that's another layer of problems that we're dealing with. Then we got to get it around. There's the door. Then we got it. Okay. Then we got to get it around the blood, around to the body, and as it comes around to the body, is the sympathetic nervous system, parasympathetic nervous system, allowing for the effusion factor to allow sufficient crossing of oxygen and exchanging for carbon dioxide and all the other things that happen with that. If they have cold hands and cold feet, they have a cold brain, because that's an extremity too. And that's an autonomic issue, that's in the factors. So if I got a cold brain, now, even though I'm getting the blood, I got good oxygen in, I got it distributed within my blood, I'm getting the blood around to the brain, but the brain isn't getting the blood flow, the efficiency that the rest of the body's getting, because the sympathetic nervous system is choking the blood flow. If you can imagine, my grandma taught me how to garden, and she'd say, put your thumb on the hose, and as you put the thumb on the hose, you're going to change the pressure, and you're going to be able to water farther out. But if you push harder, you'll choke that flow. And that's what's happening with the cold hands, cold feet, and cold brain. And there are many different things that can facilitate that can cause that. So we have to eliminate those factors. And so that's the oxygen, and there are others. But now we'll go to carbs and sugars. Do we have issues with carbs and sugars? Are we eating the right kind of carbs and sugars? Are we eating the kind that are cheap and junky? And even though we get a little of the good of carb effect, boom, they're gone. And now we have an inflammatory process as a result of the carbs that we took in. Or are we eating good carbs? And they're causing you to have the better carbohydrate effect, the better sugar effect that you need. Do I have diabetes? Am I hypoglycemic? So even with the sugar problem, there's a bunch of different issues there. Those things have to be covered and taken care of. Now let's go to the protein factor. Are we getting the right amount of protein into the system and at regular intervals? If you've got somebody and they don't have the protein, and I see this a lot when people come in, yeah, I've been doing intermittent fast. And I say, hey, that's a really cool physiology to do that, but you can't, because you don't have the margin for error that these other people have. They have healthy bodies. When you're dealing with somebody who is so depleted in any way, that's depletion is not going to respond well to an intermittent fast. And so we have to stop that fasting. If we're getting the protein in, but I didn't have protein since yesterday, and she's having a crisis or he's having a crisis, we got to make sure that they get enough of and the right kind of protein, and you will see a difference in your patient when this happens, right? And the two biggest problems I deal with in this issue are protein and inflammation in the brain. When somebody has a lack of protein and inflammation in the brain, they are going to melt down. That's just all there is to it. It doesn't matter if they're a 6-year-old autistic kid. It doesn't matter if they're a 35-year-old coach, right? It doesn't matter if they're a 55-year-old doctor. It doesn't matter. They're going to melt down. And so take care of the protein problem for number one. Number two, take care of the inflammatory problem. When you have brain inflammation, and if you're a medical doctor, you have anti-inflammatory processes that you can use, chemistries that you can use. I'm not a medical doctor. I tend to use things like omega-3s with high EPA. I tend to use curcumin, turmeric, but also krill, and that's my tool of choice when I'm dealing with brain injuries, particularly when somebody's having a flare-up. If they got an autoimmune and they're having a flare-up, I hit it with krill. And when I'm using krill, you see that inflammation go down. You will see the change in the behavior of the patient, right? You handle the protein, handle the inflammation, and now the problem is going to come down to a more manageable level. That makes sense? Okay. All right. So if I'll just continue. In that, now that we've talked about working with the needs of the patient, and that, realize that there are factors that we have to learn how to see and learn how to address. And I call it lizard brain versus personality, right? I learned it from my kids. I learned that when they were having big problems and they were freaking out, I learned that they were in a different part of their brain. They were in what we call the lizard brain, which is the basal ganglia. It's very basic, and it doesn't think. It's a reflex system. The basal ganglia, if you think of the nervous system as a car, and that car is the brainstem and spinal cord, and it has everything you need to work, to move, to do things, and that to keep you alive. And when they say he's brain dead, that means the driver is dead. Car still works, but the driver facilitates and helps the car. And so if it dies, this thing's going to wind down to death too. But that car, is, like I said, the brainstem and spinal cord. But then you think about all it needs is the driver. The driver is a 3-layered driver system. The first one is what we call the reptilian brain, or the basal ganglia. It's the reflex system, the reflexes that you have created, that you've done over and over again, brushing your teeth, riding a bicycle. Also emotions that you tend to do when you see a certain situation and it triggers an emotion. That's basal ganglia that's bringing up past programming that you've put in, that you've literally wired in. This isn't software, this is hardware. And so that hardware system is that reptilian brain. Then you've got the limbic brain, which is the emotional brain, and then the neocortex, which has most to do with walking and talking, but also that's where a lot of the higher functions are. The basal ganglia versus the limbic and the neocortex. When you look at the limbic brain, I know my wife would always say, "Smile for the camera," and I would always go, and she'd say, "No, a real smile." This is a limbic smile. It came from a different area of the brain, hijacked the same pathways, but got a completely different kind of a smile, completely different tonal quality, right? You can look in your yearbook and you can tell, hey, I was really happy there. Or, boy, I was faking it there. I was not happy. Or I can see I was mad, but I was smiling. I can even see it, right? Well, that's those different areas within the driver. The basal ganglia is the lizard brain, and when the kids are freaking out, this is where I learned it, they're in their lizard brain. And I have learned never negotiate with a lizard. That's my rule. And it works. I become a drill instructor. I tell them what to do. And so my demeanor is, listen, you're gonna do this. I know you're not gonna like it, and we're not doing it so that you be uncomfortable, but you're gonna do this. Yes, you're gonna eat this protein. I know you don't want it. You're gonna do it though. Drink this shake. You're gonna do it. And then have them do it. And what I do is, when I get that lizard brain to change, and normally one of the biggest signs is their pupils will be really big, which is the pupil is a window into the sympathetic versus parasympathetic, how they're functioning together, because there'll be times where it's mostly sympathetic and times where it's mostly parasympathetic. Well, when it's mostly sympathetic, you have big pupils. When you have mostly parasympathetic, they're tiny. And so when it's big, I'll be doing what I'm doing to get out of the lizard brain and into the rest of the brain. And all of a sudden I'll notice their pupils will get really, much smaller than they are. And that's when I start to talk to them, and I might even negotiate. But I never get hijacked by terrorists. Right? I don't negotiate with terrorists. And so knowing that, and feeling their needs before you ever start, and making sure that you've got them to where we're not dealing with the lizard brain now. We're dealing with the person and that. But when they're in meltdown, if you try to negotiate with them, or you try to be nice, and you're actually going to make things worse, right? If you don't fill those needs. So that's been my experience over a long period of time. I've been doing this stuff for almost 30 years. And the other experience that I have is with my oldest son is 37. So 37 years of hostage negotiation experience. So in dealing with that, and then we'll step back from all of that and we say, okay, what is the next thing as a clinician that is so helpful in dealing with these kinds of problems? Is to start from a position internally as a clinician to see the patient as a person. In the United States, we've really come up with a big problem, because we by far spend more money on diagnostics than any other country. In fact, we spend more than almost all the other countries combined on MRIs, CAT scans, DAT scans, ultrasounds, and there's new ones coming out every day, and we spend so much money. But the next most expensive place diagnostically is Japan. But they have a completely different set of outcomes than we do. They have a completely different set of outcomes. Why? Because when we do diagnostics, it's with the intent of diagnosing the problem and finding the disease and treating the disease. When they diagnose, they are diagnosing the disease, but they are treating the person. They're treating the individual. They see the person as an individual and as a person, and so they're working with them, and they get a completely different outcome compared to us, even though we are far superior, with our diagnostic skills. Actually, we're not. We're actually quite horrible, because we've lost our observation skills, and we've lost our physical exam skills. I mean, neurologically, the neurologists don't know how to do physical exams anymore. and because they've totally gone to relying on the diagnostic modalities, and if the diagnostic modalities don't show anything, it's got to be in your head. When many problems are physiological rather than ablative. It doesn't show up, right? And we saw that in the movie Concussion, right, where Will Smith played the doctor that figured out the CTE problem in the NFL, that they were getting damage that wasn't visible on the MRI. And he saw that it was a severe disruption of not only the cells, but also the blood flow system within it. You have 400 miles of blood vessels in your 3-pound brain. I'll let that sink in for a minute. And so disrupting that blood flow disrupts everything that's going on in there. And so seeing the person as a person, seeing them not as a disease or a kidney. It's got a kidney, this whatever has a kidney disease. Say, no, this is a person that's having some kidney problems. So let's figure out how to help that person express health within their body rather than trying to kill the disease. That's a completely different approach, a completely different mindset, completely different seeing the world, right? And it'll bring you quickly to, I can't judge anybody. And the other thing that I do that I really feel made a difference in how I treat patients is I don't treat the what, I treat the why. I can tell where things are coming from a symptom point of view. That's actually easy. What I always want to know is why. Why are we having the migraine headache? I know where the symptoms are coming from. I know. It's coming from the midbrain. The midbrain cuneiform nucleus is causing a radical shift in the blood flow to my meninges. I got C fiber pain. It's taken over my entire body. I've got the colliculus, the colliculi, the superior and inferior colliculi are right in that midbrain. They're having trouble with the hypersensitivity. They are ramped up, so I'm hypersensitive to light and sounds. I got the cuneiform nucleus, which is causing me to run a hypersympathetic tone. I've got it's adversely impacting the cranial nerve 10. That's where the nausea is coming from. That's all the symptoms, right? But I want to know why. Why is the midbrain dysfunctioning? Because that could be for 1,000 different reasons. I've heard all the time, well, it could be a heart issue. Yes, yeah, they could be a part of it, right? Why isn't it happening on both sides though? That would be a question I would ask. I'm always trying to find out the why. It could be a breathing issue. It could be that I drank a toxin and I knew it or didn't know it, right? Either way. Okay, but why there? Why is it doing that there? And what's the real why behind it? Okay, so we'll stop drinking toxin, but I still have that weakness that I can express that migraine. I want to strengthen the area, the problem that is causing that midbrain to be ramped up compared to the other side. I want both sides to work equally. And so in that, seeing the patient as a person, seeing the patient as somebody with real feelings, with things that may be happening from a functional point of view, meaning the circuitry is dysfunctional, having a problem, or what we would tend to call more mind issues that I call software, patterns that they've run over the course of their life, and that issues that have cropped up because of things that have happened in their past, seeing those as parts of the layers of this onion that we're trying to peel back each of the layers of these problems. And so doing that, I have a favorite song. It's a hymn actually, but in it gives the credo that I've tried to live in my life as a clinician. And it says, I would be my brother's keeper. I would learn the healer's art. To the wounded and the weary, I will show a gentle heart. Try to get that and keep it every day. And when you're in front of one of them, this is a life that you can help. So help them. But you got to see them as your brother or sister that you're trying to help. And that you're willing to do and say what needs to be done and said. And to put the pride aside and put everything else that may be pressing on you, insurance companies and all of the governmental issues and all the other powers that be that exert themselves, many of which have created a lot of these problems that we have, and go to try to help that person, that brother or sister. So those are the things they don't teach you in school. And if you don't get them, your clinical experience is going to be very hollow, because you're going to miss out on some miracles. And it's not a miracle that you performed, they're the miracle. What else would I say to a clinician, right? To a doctor that I wish I'd have known when I started? Be okay when they're pissed. Be unaffected by their response, their reaction. Be unaffected by it. If you really want to help them, which you do, you're watching this, right? If you really want to help them, you will see them as somebody who needs help and that you want to help. And anything that they do, you will see them like a wounded animal that you're trying to help. And all of that response is a reaction to protect themselves. And so you have to stand back and be okay with it. In our clinic, we see it a lot. Patients come in, they're very angry, or they're very hostile, or very, very depressed, or very untrusting, and that because they've been to so many different places before they get to us. And my staff just has to learn, they have to learn that usually is not them. And as we dig through and start to get a decrease in their symptoms, a lot of it is pain and more importantly, suffering and that. And as we get rid of that, all of a sudden we meet this person that is sweet and loving and a joy to take care of. And occasionally we find out we get rid of pain and the person is just a jerk. And you have to be okay with that because you want to help them too. So, but and then that's we have our meetings, our team meetings, and we go over each case and how we're helping them and that and I know it usually brings a big laugh. Yeah, once a jerk, always a jerk. but at least they're out of pain now. At least they're living a better life now because of what we did and that. So be okay with that, and shield yourself from it. The hard part of what we do is you probably got into this because you wanted to help people, and you're being beaten down by, like I say, all those powers that be, and you're being beat down by your own patients, the ones you're trying to help, and that, and it has a weighing down effect, a weighing down impact, on you, and you have to grow some thick skin to protect your heart from those things, and say, okay, but I'm still helping. And how many are willing to put themselves at that hazard in order to help, and that, and because of your talents and because of who you are, and who you've been in the past, you're the one that can help them. And so toughen up, man. Suck it up and get tough. And that's real toughness. That's real toughness, because sometimes you'll go home and say, man, I tried really hard, but I feel like I've been beaten down. And so, yeah, but then you'll help somebody who is on the edge of suicide, and all of a sudden you remember why you're there, and that. So that's one of the analogies that I gave to a kid who wanted to commit suicide. And his question was, why is God allowing me to suffer like this? Why am I going through this? Why do I have to? I've been good my whole life. And he was a great kid. I mean, phenomenal. He had spent 2 years serving a mission for a church, and that's a kind of devotion to loving others and helping others, and still he had this deep pain that he wanted to get rid of. And that he said, why do I go through this? Why does God let me suffer like that? And I said, I don't know the mind of God. I said, but I do know suffering, and I do know depression. And what I've arrived at that makes me feel stronger is that this is like SEAL training, Navy SEAL training, that the SEALs lay in the surf. They're all constantly on the edge of hypothermia. They're wet, they're sandy, they're cold all the time. They're given tasks to do that are beyond their capacity, and to build them and to build the group as a team, and that. And as they do that, they are becoming something different. And if they keep going, they become the ones that run towards the bullets. They're the ones that are the first in and the last out. They're the one, when you're in a bad situation, they will come and find you, and it doesn't matter how bad it is, they're not leaving until they get you out. And so these individuals that are suffering, I believe, are people who are learning suffering and sorrow to take it, to handle it, and to go to a different place because of it, and to be able to console others. And part of that, what is gained, is the ability to bring confidence in those that you help, that they see when you say, I get where you are. I know that pain, and they know you know, because they see it, they feel it. Whenever somebody says, yeah, I know what you're going through, and you can see, no, you don't. You've never been there. You don't know. Say, and so knowing that has been helpful to me personally. And the young man that I was able to help just got married a week ago to the girl of his dreams, who he didn't even know when we talked. And a week before, he was trying to kill himself. So that is why I do what I do. And I ain't leaving. It's why we used to do this work, right? Our brethren from the past. And they were often accused of things, and often were the ones who had to watch the tragedy, who couldn't quite save somebody, who tried and stood there with the family and held their hand. That's who we were. We need to go back to that. We need to go back. If I were to know what I know now back then, I would be telling myself to learn as much as possible all the way through. And I've had a chance to do that. There have been times where I've laxed in it, but lately that has turned into a fire. It took a while to get there. There were definitely, I had talents that I didn't realize I had, and some of those were pretty much carrying me. Now I have a dogged, relentless drive to learn as much as I can, and to feed my mind, especially related. I tend to spend my time in neuroscience, but to feed my mind and constantly look around wherever I am and learn everything I can from everywhere and everything, so that I can be the highest level help I can be whenever I'm standing in front of a patient. For me, also realizing that the core of me is my faith in a divine Heavenly Father. And that He knows everything. And that I've crammed a lot of facts in my head, but I don't know if they apply. And to be open to hearing. When I was a boy, I remember hearing a story about a telegraph operator. A kid wanted a job as a telegraph operator, and he responded to this ad, and he went into the room that was the waiting area for the person who was the manager who was going to do the hiring. And there was a whole group of people there, and they were all talking to each other. And the boy went in and sat down. He was the last in, sitting down, and then all of a sudden he stood up and walked over to the door and got in, and everybody was incensed that this presumptuous kid had gone and stepped into the office, and they were all there waiting. Why weren't they be taken in order? And about 5 minutes later, the manager opened the door and said, "You can all go home now." I found the person I want for the job. Unbeknownst to you, on my desk I had a pad of paper, and with the eraser on the back of my pencil, I was tapping out a message. If you can hear this, come into my office and get the job. And he heard it, and you didn't. So if you want to hear that voice, it is a still, small voice. And so you're going to have to calm your mind and calm your heart to be able to hear it. All the greats listen to that voice. From Isaac Newton to Einstein, Bohr, all of them were heeding a voice. Something that taught them things they were never taught. If you're looking for help, listen for that help. It means often, too, you're going to have to be quiet in a loud place. It means often, too, that you're going to have to push your pride aside. You're going to have to realize that you don't know. And listen to that voice. If you're willing to do that, you will be taught from on high. And you will know things that we don't know. That's my experience. And it's really handy too to realize, and you say, well, how can I have confidence in that? It's actually easier than you think, because you're serving his children, and he would want them blessed, helped. So if you're willing to be open, he wants to help you.